Hello, everybody. Welcome back to another lecture in our medical microbiology for medical students series. Today, we'll be talking about gram-negative bacilli. My name is Brody Duncan. I am a physician and medical microbiologist here in Hamilton, and I am an assistant professor in the Department of Pathology and Molecular Medicine here at McMaster University. So, our goals today are first and foremost to learn the names of medically important typical gram-negative bacilli, which are those that will, grow in the routine blood, urine, sputum cultures that we send. Today, in particular, I'm really going to emphasize just learning the names is the number one step as a medical student. There are so many gram-negative bacilli that you will not be able to keep all of their different epidemiologies, clinical presentations, treatments straight. So today, especially the first time you watch this, really just learn the names, and then you can rewatch this video later in your medical career to try and really cement things in after you have some clinical experience. We are going to talk a bit about the diversity of different infections caused by gram-negative bacilli, so that hopefully it can give you some little clinical tidbits to associate with the names in your head. We're also going to talk about the typical epidemiology, especially of the most important gram-negative bacilli. And finally, we will talk a little bit about how to understand the complex decision-making around good gram-negative, quote-unquote, antibiotic coverage. So here's our big summary slide that we've seen before of all of the typical bacteria that will grow in routine cultures. Today, we are focusing on the right, which is gram-negative bacilli. Again, this is such a humongous group that you will have to probably watch these videos multiple times, and we'll split it up into multiple videos so it's a bit more bite-sized chunks for your brain to remember. Gram-negative bacilli, as you would expect, are gram-negative, which means they kind of have this red-pink coloration, and they are bacilli, which means they are rod-shaped. Some of them are a little bit longer, some of them are a little bit shorter, almost like verging on coccoid, but in general, they all kind of have this sort of picture. There's not a whole lot of utility to staring at gram stains and trying to differentiate, what E. coli looks like versus Pseudomonas looks like. They're just GMB in general. I'll emphasize again that because of that, there's really not a lot of specific phenotypic characteristics that you as a medical student can use to differentiate the names. There's a lot of memorizing. It's a lot of brain work. It's going to be a lot of brain power to memorize all these names, and it is not fun, but we're going to do it, whether you have to watch this video 1 time or 10 times, and eventually it'll hopefully stay in your head. So we're going to start by talking about Enterobacterales, which is really the most common and most important family of gram-negative bacilli. In small little parentheses, I put here that they're also known as Enterobacteriaceae. That's the name that I learned when I was in medical school, but a few years ago, some of the basic scientists decided, you know what, that's not exactly right Latin. We're going to do Enterobacterales, so it fits in our taxonomic scheme a little bit better, which is very annoying, but as medical physicians, unfortunately, we just have to suck it up and memorize new names as they come at us. So Enterobacterales is the name of this family we'll talk about first. The good news is that a lot of these bacteria are ones you're probably already familiar with. The common ones you can remember with this PEC acronym. So it's E. coli, Klebsiella pneumoniae, and Proteus mirabilis. These are hands down the 3 most common Enterobacterales. E. coli, obviously, everybody knows. All of these organisms typically live in the digestive system. This is where the name Enterobacterales come from, entero being intestines. These are normal parts of the human flora. Everybody has them in their guts. And, if you take a stool sample, you will find it full of E. coli and Kleb and Proteus and all of those things. However, they are still not our friends, really. We're tolerating them as commensal organisms, but on the whole, from a medical point of view, they do cause harm. I'd say the most obvious example of this is urinary tract infections. So even though these bacteria normally live in the intestinal tract, if they go from the intestine and scooch up into the bladder or then further up into the kidneys, then they can cause mild or serious life-threatening disease. So again, this is an example of if you take a stool sample and find E. coli, it's not a big deal. If you take a urine sample and find E. coli and your patient seems like they have a UTI clinically, then it probably is really the pathogen. Another tricky thing about these Enterobacterales is that they do not just cause UTIs, they cause this humongous wide variety of clinical presentations. both in outpatient and inpatient settings. Here's just a smattering of them. Like they can cause wound infections after a surgery. They can cause pneumonia, especially in hospitalized patients that have gotten prior antibiotics. They can cause life-threatening disease in newborn babies. And in fact, E. coli is actually one of the #1 causes of meningitis in very young babies. And they can also cause more run-of-the-mill things like Lyme infections if you just have a little bit of E. coli slipping its way onto the patient's skin and then getting on the line and then into the line and into the patient's blood. So like you really do have to understand these organisms. And once you start seeing patients, you're going to be seeing these names over and over and over again. E. coli, Klebsiella, Proteus, both for outpatients with simple cystitis, urinary tract infections, and inpatients who are dying of bloodstream infections. So those are the common ones. There's these less common ones, which, certain mnemonics that people use include ek, and some people use spice. I'll talk about that a little bit. They're all Enterobacterales, so they all live in the digestive system. And similar to E. coli and Kleb and Proteus, they are not our friends if they go outside the digestive system. They can cause all the same sorts of clinical manifestations in hospitalized patients and outpatients and little babies and older people. If they get outside the intestine, they can really wreak havoc. But the issue is that there's just so many of them that as a medical student, it's like, how are you going to memorize all these names? So, ek is another mnemonic you can try to use, where ek stands for Enterobacter cloacae, Citrobacter fungii, and Klebsiella aerogenes. These three are being pulled into a mnemonic because they're a little bit more, I don't know if aggressive is necessarily the right word, but more difficult to treat than your run-of-the-mill E. coli. They tend to be antibiotic resistant. You tend to see them in patients that have been in the hospital and are sicker at baseline. You don't tend to see these organisms causing just simple bladder infections in outpatients. So ek, I think, if you have to memorize Enterobacterales, once you have E. coli, Kleb, pneumonia, and Proteus mirabilis down, trying to memorize these ek organisms is probably useful. To make things even more complicated, there's this other acronym called SPICE. So SPICE is Serratia, Providencia, Indole-positive Proteus, Citrobacter, and Enterobacter. This is an acronym that, again, I was taught as a medical student, kind of as a counterpart to ek, but there's actually new research saying maybe things like Serratia and Providencia, Indole-positive Proteus are actually not as important compared to things like Enterobacter and Citrobacter. So, you might hear different things from different people, whether we talk about ek or talk about spice. Spice, I've always kind of hated it as a mnemonic because it's really an oversimplification if we're just trying to talk about Enterobacterales in general, because there's also relatively common things like Hafnia and Morganella, and then there's like really obscure ones called Rotella, Pantella, Chronobacter. So, I have, historically expanded spice into even bigger things like spicy ham, just as mnemonics to try and shove all these stupid Enterobacterales into my brain. But nowadays, honestly, like ek and pec are probably your top tier Enterobacterales to know, and the rest of spice is a little bit of a bonus. So a little star on ek, do try to memorize these. And then a little question mark on SPICE, which is our broader acronym, spicy ham or whatever you want to do. I think at the medical student level, these are lower yield. Again, I'm sorry, this sucks. Just like you have to memorize these. There's really no great way other than just knowing all these species names. So next we'll talk a bit about the true GI pathogens that are inside of Enterobacterales. So Salmonella, Shigella, and to a lesser extent Yersinia are cousins of E. coli and Kleb and Proteus, but they are nasty in a different way, that when they get in the digestive system, they don't just sit there and hang out and be part of the normal flora, in a friendly way, the way that E. coli does. They actually cause pretty significant symptoms. Salmonella and Shigella and Yersinia cause diarrhea. They cause vomiting. They cause fevers. Some species and strains of these can actually cause really severe disease like typhoid fever, which does kill people. So these are important organisms to try and keep separate from the rest of them because you're not going to be seeing them in the same clinical situations. Shigella is not going to be causing a wound infection in your postoperative patients. But if you've got a patient that comes in and they're having profound bloody diarrhea, that's when you have to think about salmonella and Shigella, those sorts of things. As a little bonus, because it's not complicated enough, Yersinia pestis might be a familiar name to you because it is a horribly deadly pathogen that causes the plague. So, we all think about plague as being this historical thing with these doctors wearing these, bird masks, but it is actually still a modern disease. Bubonic plague does still happen. It's not common in North America, but there are places around the world where they regularly have outbreaks of bubonic plague, and this does kill people. So Yersinia pestis, it's a bit of trivia here in Canada because you're almost certainly never going to see this. But you do have to be aware that it does exist. And for whatever reason, it is still in the same family as all the rest of the Enterobacterales. So that's where we squeeze it in as we try and memorize all these bacteria. To make things even more complicated, unfortunately, there's actually even more E. coli that are enteropathogens. So as I said, E. coli, is like Klebsiella and Proteus, that it is a normal part of the human flora. It lives in the gut and normally does not cause any problems. But there are these strains of E. coli that are enteropathogens that cause true disease if you pick it up in your gut. And they can give you vomiting, diarrhea, bloody stool, the same way that Shigella and salmonella can. So, there's a bunch of different names for these: E-Tech, S-Tech, which is Shiga toxin producing E. coli, EAEC, EIEC. It's totally outside the scope of these lectures to really go into these in detail, but you do need to be aware that there's your run-of-the-mill E. coli that causes bladder infections and stuff, and then there's these special E. coli that do cause intestinal disease and should not be part of your normal flora. For example, S-Tech very famously in Ontario caused the Walkerton outbreak, which actually killed a bunch of people when it got to the water supply. So these are all organisms that we do have to be familiar with. The good news is that I think that that's where I would draw the line for Enterobacterales. I don't think you need to know more than what is on this slide right here. So this is going to be the end of the first lecture talking about gram-negative bacilli, and join us for the next lecture where we'll talk about non-fermenters.